Hello, this is a presentation on sickle cell anemia. Sickle cell anemia comes from a group of disorders known as sickle cell disease. This is an inherited red blood cell disorder. As you can see, red blood cells are normally in this flat kind of circular disc shape, and sickle cell red blood cells are sickled and have kind of this crescent moon shape. Basically, this disorder just means that the body does not have enough healthy red blood cells to carry oxygen throughout the body itself. This disorder is an autosomal recessive trait on sickle hemoglobin. This means that either mother or father could pass the trait, but in order to have the disease itself, the children need to have both genes of the HBS, which is the sickle hemoglobin. So if you look at this first top pedigree, if both parents are carriers of the trait, but neither of them present the disease itself, they have a 1/4 or 25% chance of passing the disease on to a child. They have a 50% chance of passing the trait onto a child, making their children also carriers, or they have a 25% chance of having a child that is not a carrier and does not have the disease at all. Now, if you look at this bottom pedigree, this explains if one parent has the trait but does not present the disease and the other parent does not have the trait or the disease itself. They will have a 50% chance of presenting children that have the trait, so they're carriers, but they do not present the disease. And then they have another 50% chance of having children that are not carrying the trait at all.
There are many common symptoms that characterize sickle cell anemia. The common symptoms are anemia, painful episodes, swelling of extremities, infections, delayed puberty, and vision problems. But there are also some more dangerous symptoms that are often associated with a sickle cell crisis, and those are fever, severe pain, abdominal swelling, pale skin, yellow tint, or signs of stroke. And if any of these symptoms are noticed, that person should immediately seek medical attention and treatment. Sickle cell anemia is caused by a dangerous mutation in the gene that regulates the production of iron compounds, which produces a red blood and protein, hemoglobin, that carries the oxygen in the blood. When the gene mutates, the hemoglobin becomes misshapen, rigid, and sticky, which inhibits its ability to flow through the bloodstream. The gene that causes this mutation must be inherited from both parents. If only one parent has the gene, then the offspring will not be symptomatic. Though they may have a few abnormal sickle cells flowing around in their bloodstream, it will not be enough to cause a problem. And as you can see, when a cell is affected by the sickle cell mutation, it is often a half moon shape, sharp on the edges, doesn't flow very well through the bloodstream, and especially when it's compared to a normal red blood cell, which is rounder, smoother, and does flow through the bloodstream, you can see how this misshapen sickle cell really would be a problem long term. Now, currently, there really is no standard form of treatment for sickle cell. Most of the treatments are really only used for pain management and symptom management. The most common forms of these treatments include blood transfusions and pain medications to, like I said, minimize pain and minimize symptoms. Although hydroxyurea is one of the few drugs that has been tested and proven efficiency in decreasing the crisis in relation to sickle cell anemia, the drug's effectiveness is due to its ability to inhibit the HBS polymerization that causes the sickle of the cell. And sickle cell hemoglobin, or HBS, is an example of a genetic variant of human hemoglobin, where a point mutation in beta globin gene results in a substitution of glutamic acid to valine, a sixth position of the beta globin chain. The only cure for sickle cell anemia is a bone marrow transplant, which is a very dangerous and very rare procedure due to the fact that it can be very, very hard to find an exact match. And even if you do find a match, there is no guarantee that it will work.
How is the disorder diagnosed? Sickle cell anemia is a red blood cell disorder that is passed genetically. In order to diagnose it, a blood test called a high-performance liquid chromatography is used to identify what type of hemoglobin is present. This test is usually done to newborns to around 4-month-old babies when symptoms start showing. And in order to confirm that the baby has sickle cell anemia, a genetic test is usually done. Genetic counseling is a great option for couples to see if this autosomal recessive gene would be passed down to their children. The goal of a genetic counselor would be to find out if their child would be at risk for sickle cell anemia and if it runs in the family. If the baby is diagnosed with sickle cell anemia, they would be referred to a hematologist, which is a doctor that specializes in blood disorders. How many, what type of people have this disorder? Sickle cell anemia is from a mutation in hemoglobin gene protein that is passed down as an autosomal recessive trait. This disease is most common in families with an African descent, with 1 in every 12 people from this background being a carrier for this mutation, and with 1 in every 365 babies being born with it. Also, for Hispanic communities, it is around 1 in every 16,300 births. Currently, worldwide, there is around 25 million people who are currently living with sickle cell. Sickle cell anemia occurs in all backgrounds, but people of African descent and people of Hispanic communities are more likely to have the gene.
Moving on, this is the research article that we decided to explore. It is called The Inheritance of Sickle Cell Anemia. It was published in July of 1959. And basically, this is when sickle cell was fairly new. It was about 50 years old from being discovered. And scientists were just trying to figure out how it was inherited. So this doctor decided to explore the disease and how it was inherited, and he decided to follow 2 hypotheses. The first one was the ability to sickle was due to a single dominant gene. And then the second one was a gene which in heterozygous condition results in sickleemia, and in a homozygous condition, it results in sickle cell anemia. Now, if you don't know, sickleemia does not occur under the conditions of circulating blood like sickle cell anemia does, so that's how the 2 are different. Following these hypotheses, it was assumed that the homozygous form of sickle cell anemia was lethal, but when the scientists started to explore this, the parent numbers were too high, he thought, if this homozygous dominant form of sickle cell anemia was supposed to be lethal. So he tested 42 parents of 29 patients with the disease, and he was shocked to find out that every parent sickled was positive for sickle cell anemia. And so this is when the hypothesis was disproven, and he was able to disprove it because the probability of every parent having sickle cell anemia under the first hypothesis was 0.00013% of a chance. So basically, this first hypothesis that many scientists had followed up until this point was disproven, and sickle cell anemia was found to not be a dominant trait. It was recessive. And here is our bibliographies. Thank you.